discuss about the subcutaneous mycosis. Before that, how the mycosis, mycotic diseases, they are classified into four groups. First group is superficial mycosis, and subcutaneous mycosis, systemic mycosis, and opportunistic mycosis. First, we say about this systemic, yes, subcutaneous mycosis. Subcutaneous mycosis, the agents of subcutaneous mycosis usually inhabit the soil. And how they enter in the body? So they enter the skin by traumatic inoculation with contaminated material, and they have tend to produce granular matrix lesions in the subcutaneous tissue. Now, types of mycetoma and its causative agents. Now, actinomycosis, it is caused by either fungi or either bacilli. Now, the actinomycetoma or actinomycetoma caused by fungus is called as eumycetoma, while the actinomycosis, it is caused by bacteria, it is called as actinomycetoma. And the third group is botryoomycosis. It shows similar symptoms of this actinomycosis, but it is caused by bacteria, and that is Staphylococcus aureus. It's a botryoomycosis, mycetoma-like conditions caused by some bacteria such as Staphylococcus aureus. Now, organisms causing mycetoma. Now, first, eumycetoma, it is caused by fungus, and actinomycetoma, it is caused by bacteria. Now, how to differentiate between these two? It is differentiated on the basis of granules produced by them. Now, eumycetoma, it produces black granules, and the positive agents are Madura mycetomatis, Madurella gracia, Exophilia Jamesilimae, and Corollaria species. Now, white granules produced by the fungus, they are Pseudo-Escherichia boydii, Aspergillus nudulans, then Acromonium species, and Fusarium species. Now, actinomycetoma, the white to yellow granules produced by the bacteria, and the most important species is Nocardia species, most commonest cause. Apart from that, the Streptomyces somalinensis, Actinomadura maduri, and pink to red granules, it is produced by Actinomadura pilleteri. Now, pathogenesis, accidental trauma. It is also called as caused is thrown prick or splinter injury. Now, organisms enter the skin or subcutaneous tissue from contaminated soil, where it produces microabscess by polymorphs and develop the chronic granulomatous tissue in skin and subcutaneous tissue. Now, clinical types. First is it produces tumor-like swelling, also called as tumefaction. Then the second one is also discharging sinuses, and third one is discharging oozing from sinuses from contaminated granules. Commonest infectious site is feet, and also it causes bone infections or infects bone, and it is known as osteolytic or osteosclerotic bony lesions, which are usually painless. Now, what is the difference between this actinomycetoma and actinoeumycetoma on the basis of their clinical symptoms? Now, first, tumor produced by eumycetoma. The eumycetoma, it produces single well-defined margins tumor, while in actinomycetoma, it produces multiple tumor masses with ill-defined margins. Now, sinuses. In sinuses, in eumycetoma, it produces appear late and also in a few number, while in actinomycetoma, it appears early and shows numerous with raised inflamed openings. Now, discharge. Discharge produced in eumycetoma, it is serous, while in actinomycetoma, it is purulent. Now, grains. What type of grains is produced in eumycetoma and actinomycetoma? In eumycetoma, it produces black or white grains, while in actinomycetoma, it produces white or red grains. Now, the bone infected. In eumycetoma, it causes osteosclerotic lesions, while in actinomycetoma, It causes osteolytic lesions. Now, what type of grain is observed in eumycetoma as well as in actinomycetoma? In eumycetoma, it shows fungal hyphae which is more than 2 micrometer in size. While in actinomycetoma, it shows filamentous bacteria which shows less than 2 micrometer in size. Now, epidemiology. Now, this actinomycetoma, it is endemic in Africa, India, and Central and South America. Globally, actinomycetoma is more common, and it infects about 60%, while in eumycetoma, it is up to 40%. Eumycetoma is more common in Africa, and in India, it is common in Rajasthan. Reports the maximum cases of mycetoma per year, followed by Tamil Nadu and West Bengal. Actinomycetoma predominates in India up to 65%, except in Rajasthan where eumycetoma is more common. Laboratory diagnosis. Now, what sample should be required for diagnosis of this actinomycetoma or actinomycosis? Now, specimen required. It depends upon the type of lesions produced by the fungus or whether bacteria. Now, specimen collection, grains collected on sterile gauze by pressing the sinuses from periphery or by using loop. Direct examination. What can be observed in direct examination? The granules washed in sterile saline, crushed between the slides and examined under microscope. First microscope, or before that, see the macroscopic examination. What can be seen in microscopic examination? See the color of granules, its size, shape, and texture. Now, the bacteriological diagnosis. If the fungal diagnosis suspected eumycetoma, then we have to do KVH mount. In KVH mount preparation, observe hyphae of more than 2 to 6 micrometer width along with chlamydospores at the margin. If suspected actinomycetoma, we have to show this. We have to do this gram staining. In gram staining, see filamentous gram-positive bacilli measures up to 0.5 to 1 micrometer in wide, and the most specific stain recommended for the demonstration of this nocardia is modified acid fast stain. Nocardia, it is weakly acid fast. Now, see what type of granules can be seen. In eumycetoma, granulomatous reaction with palisade arrangement of hyphae in the cement substances. See the first figure. And in actinomycetoma, see granulomatous reaction with filamentous bacteria at the margin. Culture. If fungal eumycetoma is suspected, then we have to inoculate the sample both on Sabrodextrose agar and also on Loweston Jensen medium, selective medium for this nocardia, and also blood agar. Eumycetoma agents, see the growth rate, colony morphology, production of conidia, and their sugar assimilation pattern. Agents, if suspect with actinomycetoma, see the growth rate, colony morphology, urease test, acid fastness, and decomposition of media containing casein, tyrosine, and xanthine. Treatment. तो सबसे पहले तो ट्रीटमेंट है कि देयर इज सर्जिकल रिमूवल ऑफ द lesions followed by antifungal and antibiotic treatment. In antifungal agent for eumycetoma, the treatment recommended is itraconazole or amphotericin B for 8 to 24 months. If actinomycetoma suspect, antibiotic recommended is amikacin plus cotrimazole. नहीं तो वो सबसे पहले लाया था.